A clinic in the sprawling township of Alex, daily inundated with patients, from those suffering from chronic diseases to casualties. Last Friday, a nurse tested positive, and it's believed she was still allowed to report for duty.
On Sunday, the colleague was working.
A colleague is fearing for her life.
She was allowed to go home on Monday so that she can quarantine herself. But as a staff, members who were not told, and even now they are still hiding that.
She claims no other staff member was tested and that they do not have protective equipment.
After this lady's results, we have never been tested. They are saying if you've got any symptoms, it's then that you can be tested. Otherwise, if you don't have any symptoms, then you must just use the PPE. And even the PPE, we don't have the PPE.
And concerns over her contacts, including patients and family.
So I just hope God will protect me. Yeah. Because I'm worried about my kids, so that they don't get this disease. Those clients, if you are not tested, if you are not quarantined, then these clients are also going to be infected, because right now we don't know if we are positive or we are negative.
This man had to wait outside while his wife and 5-day-old child were attended to.
We've been locked up in our house. Now to be exposed to this is really scary. I think if I had known this before we came here, we wouldn't have come.
They were supposed to let me know before I entered, but none told me. So I went and I thought nothing was happening.
The Public Servants Association wants accountability.
We've asked that the Minister of Health must intervene, that he bring the Department of Health and Gauteng back on track and indicate to them how they should be helping it, that there should be care not only for the patients and stuff, but also for staff members. Without that staff members, nobody would be able to resolve this or flatten that curve again.
Gauteng Health has confirmed the case.
We have been able to trace all her contacts, and all of them some of them, they are in quarantine awaiting their results, and some of them have been cleared. So we also went there, had a very lengthy discussion with the Labour, and Labour was also quite comfortable with the scrubbing down and the disinfection of the clinic, because we wanted the clinic to continue actually functioning, but undergoing that process of disinfection and also making sure we are able to get all the contacts traced.
The clinic is limiting the number of patients for now. It's expected to function fully early next week, but staffers are worried.
We are scared, we don't know what's going to happen. It's a crisis, I don't want to lie.
SABC News, Alexandra.